All right, so today you all are here today because you want to learn a little bit more about anesthesiology. And so we're going to have two amazing speakers today explain why they chose this field. And a little bit on our agenda. We're going to have the introduction to the anesthesiology mentorship campaign, so you know why we're doing this and the importance of it. Introduction to Mi Mentor, our team, who we are. We're going to introduce our first speaker, Dr. Carolyn Wright, and then Dr. Michael Chavarria, our second speaker. And then we'll have our questions and answers going on our Q&A, and then we'll have closing remarks.
Okay, so hi everybody. I hope everybody's having a pretty good day. So let's just talk about what exactly the anesthesiology mentorship campaign is. So just to give a little preface, and according to the American Society of Anesthesiology, only 21% of anesthesiologists were women, and only 6% identified as minorities. And even though we make up about a third of the US population, only 13% of the US medical school applicants identified as Black or Latino. And just in diversifying the workforce, it's essential that we have strategic mentorship of historically underrepresented students in medicine. So the 2022 Anesthesia Mentorship Campaign is an initiative started by Dr. Cesar Padilla, and our project aims to increase interest amongst URM undergraduate medical students regarding anesthesiology with early career exposure through a series of 6 virtual webinars with topics ranging in different related fields of anesthesiology. And this is also sponsored by Dr. Sikowski too, and he's present. So our campaign will span throughout early 2022 and will culminate in a one-day in-person event for pre-selected medical students.
All right, so who is Mi Mentor? So Mi Mentor is a nonprofit pre-health organization founded by Latino physicians in LA who noticed that there was this lack of mentorship for underrepresented minority students pursuing a career in medicine. So they support innovative and inclusive mentoring opportunities to inspire the next generation of diverse healthcare leaders for underserved communities, and it's completely student-run. And so our vision is to live in a world where all aspiring and current health professionals have a mentor and can mentor the next generation. And then our mission is to develop and support innovative mentorship opportunities that will inspire the next generation of healthcare leaders for underserved communities.
All right. So one of the most exciting things, guys, about this is I'm Dr. Cesar Padilla. One of the most exciting things is that I wish I had this when I was a medical student. And even if I were to go back in time, if I was a pre-med student, these are very sort of valuable sort of insights, right? You want to ask, what are the residents doing? And there's an element of mystique that sort of goes on. And even when you get into medical school, because we're going to manifest this, right? For all you pre-meds out there, you're going to take key you're going to take key things from Dr. Wright and Dr. Chavarria's talk, and it'll help you on your path, and hopefully you'll learn a little bit more about the field of anesthesia. But a lot of these things that you're going to learn are sort of, they're not really in the textbook, if you will. It's not, these are a lot of the inspiration was to give you guys sort of the inside look and why this is a very, sort of purposeful field for all of us. Now, our team, I want to give a special shout out to our team, AKA our pre-med Avengers. So Taylor Hollis. Taylor Hollis is our, she's the internal president for Mi Mentor Northern California. Congratulations to Taylor. She has now been accepted to the University of Alabama School of Medicine. She will be starting there in the fall. So go, Taylor. We have Joanna Gonzalez. Joanna Gonzalez is the SoCal internal president for Mi Mentor, a pre-med student. Vanessa Alvarado, who is the external president of Southern California Mi Mentor pre-med. And Rafa Marquez III, who is UC Berkeley class of 2021 and also pre-med. I want to hand the mic over to Dr. Sikowski. This is officially brought to you by the ASA Committee on Professional Diversity. So we have a grant that's helping that's helping fund this curriculum. But I also want to give a shout out to our other sponsors, the Stanford University Office of Diversity Medical Education, ODME, of course, Alliance Mentorship Mi Mentor, and also the National Hispanic Medical Association, who is sponsoring this. So Dr. Sikowski, I'll have you introduce yourself.
Oh, good evening. Thank everyone for coming. I'm Mark Sikowski. I'm past president for the California Society of Anesthesiologists, as well as for the National Society for Obstetric Anesthesia. And currently I'm chair for the ASA Committee for Obstetric Anesthesia. I would like to welcome you to this event on behalf of the American Society of Anesthesiologists and the Committee on Professional Diversity. I've had the good fortune, Dr. Padilla was my resident years ago, and I've been mentoring him since then, and he's more like a son to me, but you can see how powerful mentorship is, and someone just sort of helping to explain the ropes and what the best way to navigate the system. You know, I've been fortunate. I didn't think I would be able to do, never dreamed I would do a lot of the things I wound up doing, but 90% of success is showing up. So congratulate all of yourself for showing up. I kept showing up and they kept giving me stuff to do, and here I am now. But congratulations. And anesthesiology is a great specialty. You can do a lot of different things. I've helped to navigate legislation in Sacramento and in DC, and interacted with other specialty societies. And it's just a lot of fun, and you can make a difference. And that's, I think, easier to do from anesthesiology than a lot of other specialties, because we work with so many other different people. Anyway, you're not here to listen to me. We got some great guests today, as well as later in this series. It is a 6-part series. We have some great topics coming up, including justice, equity, diversity and inclusion, professionalism and how you can make a difference, and advocacy, because we're always there being an advocate for our patients, but that goes not just one-on-one when you're taking care of them, but at the hospital level and the society level, and even in the state capitol level. So congratulations for being here. And I hope you all choose anesthesiology because it's a great field. Thank you.
So I'm going to go ahead and introduce our first speaker, Dr. Carolyn Wright. So Dr. Carolyn Wright is a 3rd-year resident in anesthesia at Stanford University. She began medicine as a second career, starting medical school at the University of Pennsylvania over 6 years after finishing her college degree. Her professional interests include chronic pain, workforce diversity, and improving access to healthcare. So outside of work, she enjoys reading, baking, and spending time with her cat. I'll pass it off to you, Dr. Wright.
Hi everyone. Thank you so much for having me. I was just thinking about what I wish I'd known before I started this journey. I think, as I mentioned, I'm a non-traditional student. It really was a big change for me, and I had a lot of worry before coming in that I wasn't qualified enough, that I wouldn't be successful, etc. And unfortunately, I think those are messages that we hear implicitly or explicitly a lot of times throughout our path. So my goal in coming here today is just to really encourage you. I've heard similar fears from a lot of my colleagues who are underrepresented in medicine, and they are my colleagues at a fantastic place, I think really enjoying their lives. So I would love to answer your questions and just encourage you to keep going on your path. And we're here to support you however we can. I guess I'll start with a little bit of how I came to medicine, and then anesthesia specifically, and why I'm interested in pain. And if you have questions, I look forward to answering them at the end. So I guess why medicine? I was a major in Middle Eastern studies, completely unrelated. actually modern Arabic literature. I called my parents and told them that, and they were like, what are you going to do with that? And I can't totally say I had an answer on the tip of my tongue. It was fantastic. I loved it. I was extraordinarily privileged to be able to do that. But afterwards, I decided I wanted to focus more on healthcare. So I was in DC and I worked for a durable medical equipment company doing sort of fraud investigations. And then I volunteered with a syringe exchange program in DC. It was a harm reduction program to reduce HIV among injection drug users and sex workers. And I found I was really invested in helping people who had little to no access to healthcare and who were often really marginalized when they went to see sort of traditional institutions of power about medical issues. So that was when I decided, okay, I really like doing this. I love talking to people. I love thinking about questions of substance use, harm reduction, and addiction, which has been a really prominent issue over the past decade in the US, and certainly even more so now. And I went to med school thinking I would do something like psychiatry or primary care. Turns out I did not. And I found anesthesia and absolutely fell in love with it. I think it's great that you're hearing about anesthesia now. You typically apply into anesthesia in your 4th year of med school. So I did my first anesthesia rotation in my 3rd year and 10th month of medical school. And I wish I had found it earlier. I think that's not uncommon among med students because it's not a core rotation. But it just felt like fitting into a glove. And part of what I loved about it was you get to do things, you get to use your hands, you get to be the one starting an IV, you get to hang bags of fluid, you push medications that can totally take over somebody's breathing, heart rate, blood pressure. I mean, it's really cool. You're entering like this 5th dimension where you are the one driving the ship. Some people will say it's the surgeons, but secretly, I think it's the anesthesiologists. I think most anesthesiologists would agree. Yeah. So I loved being able to use my hands, being something about, I don't know, I grew up, my dad's a minister. And so something about the laying on of hands, like being able to touch a patient, being able to have that connection with the patient when you're taking care of them, it was really important to me. And then it's a really sort of nerdy specialty too. And I'm a little bit of a nerd. So I think that was a good match for me. You think a ton about what happens to somebody's heart. I don't know if you ever watched a TV show as like House or like The Magic School Bus, but sometimes in the operating room, I'm thinking about what's happening to a patient, and I just imagine sort of diving into somebody's heart and like traveling to the right ventricle and into the lungs. So it's a very sort of physically based specialty. So that's a little bit of why I chose anesthesia in med school when I had a completely different plan coming in. I'd say since starting as a resident, all of that has remained true. What I've come to appreciate is how broad anesthesia is as a specialty. Coming to this later in life, it was really important to me to find a career that I could continue doing for the rest of my life. I think changing careers was enough of a process that I just want to do it once. And I think I have found a career that I can keep doing. Some of the options in anesthesia include doing things like critical care. You can work in the operating room in many different ways. So you can be a cardiac anesthesiologist if you want to do that magic school bus dive every day, figure out what's happening with the heart, where the blood's going. You can do OB anesthesiology, which Dr. Chavarria is interested in. And obviously we have established OB anesthesiologists here, Dr. Zakowski, who can tell you more about that. You can do things like chronic pain, which is what I'm interested in, which is really a very different part of anesthesia. And then I think one of the really powerful options is that you can practice almost all of those things in low resource settings. I'm very interested in global health. I was born in Nairobi. I lived in Malawi. I studied abroad in Cairo. So I spent a lot of time in sort of East and Northern Africa, and improving global access to healthcare as well as sort of domestic access to healthcare is something that's been really important to me. It's actually something I really struggled with. When I was choosing anesthesia, I thought, I'm a student of color, like I've seen how difficult it can be to access healthcare. And so to live up to this image I had of myself, I need to be a primary care doctor. Like I need to be the person prescribing medications and seeing people for sick visits and writing doctor's notes, etc. And then I fell in love with anesthesia and I thought, how am I going to help expand access to care when I'm just working in really well-resourced hospitals doing really fancy surgeries? And as I've come to see, and as I've talked with a lot of people before even choosing anesthesia, there are many, many ways to do outreach. So if that's part of what you're thinking, and if that appeals to you, I really encourage you to consider anesthesia. And then I guess the last part of this journey, which I'm on right now, is I'm applying to chronic pain fellowship. It combines a lot of the things I was interested in before. So my experience working in harm reduction, doing syringe exchange, working with people who are using heroin and other substances, and helping manage people preoperatively. So people who are already on opioids or who use heroin have tolerance to pain meds, and after surgery can have a lot of pain. And it's really important to help manage that to prevent relapse in the future, and also just to manage people's pain adequately. I think chronic pain is something that is really hard to live with, and it can represent sort of a rupture of connection among people. So you can imagine with chronic pain, it's really hard to get out of the house. It's hard to go to work. It's hard to have fun. I had my wisdom teeth pulled once, and it is nothing like having chronic pain at all. I don't mean to establish any equivalence, but the amount of frustration and despair I felt over 2 days of pain gave me just like a very, very, very small taste of what it might be like to live with something more chronic. My dad actually has chronic back pain, and I've seen just it's had a profound impact on his life and our family's life. So I think going into a specialty where you can try to address that and help people be more functional and live the life that they imagine for themselves is really kind of a cool thing to be able to do. Let's see, I'm trying to think about other things that you might want to hear. I think throughout this process, and even before coming to medical school, one of the most important things I found is establishing really strong mentorship. And obviously that's part of why you're here and part of the amazing work that Mi Mentor is already doing. I think I sometimes felt intimidated by the idea of finding a mentor. Somebody described it as going out on a date. Like you walk up to somebody you think is cool and you're like, hey, can we grab coffee and talk? But then you're sitting across from each other and you don't quite know what to say. And you're like, I guess I'll call you. I don't know. It might be sort of, the analogy breaks down, but I think it can be awkward just to establish sort of a long-term regular interaction with somebody you don't know very well. So I would encourage you to anticipate maybe some awkwardness and to work through it, but it also can be a little bit less formal than saying like, hello, I would like to propose that maybe perhaps you could be my mentor today. It can be somebody who you just had a good conversation with, who you emailed to follow up and say, hey, I really enjoyed chatting about this subject. I found this news article. I'm curious about your thoughts. Or, hey, you told me you loved hammerhead sharks. I found this article about them. There's this cool thing at the aquarium. Would you like to see it? I have found a lot of unexpected mentors that way in areas that I didn't expect, like in hematology and in internal medicine. Again, not areas I would usually clinically focus on. But the experience I got from them, from how to do research or how to write a paper, or even simple things like, hey, if this person emails you, I recommend you email back in like 24 hours, or hey, like maybe you can navigate this social situation this way. Here are ways you can promote work you're doing, so people know. All of those things have been invaluable. So again, I really encourage you just to make connections where you can, like genuine connections that feel good to you. Nurture them. I think you'll find as you go on that those connections in turn really nurture you. Yeah, I think those are the major thoughts I had about sort of why anesthesiology and how I came to it and where I hope to go, and things that I would encourage you to think about.
Very inspiring, Dr. Wright. You know, there was just so much of your story that resonated with me. And you mentioned something, and that, if it's okay, I'd like you to sort of expand on this a little bit. But you sort of mentioned how there was almost like, I don't want to call it a pressure, but there was almost like this instinct to do primary care, right? And I think it's important for all pre-meds out there, especially those of us that are minorities, that there's not a lot of us, right, in higher education. I sort of remember feeling that too. Like I was sort of like, well, it has to be primary care. Like that's like the only way that I can serve my community. And I think it's important to dispel that myth, because it's a myth that is not only unnecessary, but I think potentially harmful, because we miss out, right? Like, so think about, we work so hard where you make it to a level of higher education and no one is really talking about this. So I think you really mentioned something that is so incredibly important, which is sort of dispelling that myth. So if you could tell us a little bit more about like how you see the field of anesthesiology as a field where you can make a difference with serving communities, with sort of addressing disparities, because I think that's something that it's a message that hasn't gotten across to the pre-med world, if you will.
Absolutely. Thank you for coming back to that. I think it is incredibly important. So in terms of the pressure to start off with, it comes from a few places, I think. One is, it aligned a lot with sort of my ideas of serving marginalized communities, underserved communities. I think a primary care doctor is somebody people are very familiar with. So I went in with that image. I think there is also the sense that the goal of increasing diversity in medical schools is to increase the diversity of doctors serving underserved communities, or like we take you from county X, and we expect you to go to county X when you're ready to practice. And I do think that is, or can be, a very limiting approach. I feel strongly that diversity in medical schools is incredibly important for the education of everyone in that medical school and all of the patients that you will encounter. So you don't need to be in county X to have done good on the promise of diversity. I think diversity is in itself an incredibly important part of how we practice medicine. And I have some stories about that later. But so I think that's one place the pressure comes from. And I think, unfortunately, that can come from higher levels of administration as well. This idea that there's sort of different paths that students are on, or where students sort themselves or might expect themselves to be. So I just really, if you find yourself passionate about something, I would encourage you to pursue that. And I would encourage you to be open, even if you think you know what you want to do coming in, be open to your experiences. There is an absolute need for minorities in all subspecialties, in all specialties, and in primary care. And then in anesthesia specifically, I think there's absolutely a huge ability to have an impact on people. So for instance, maternal mortality is a huge issue among women of color, people of color giving birth. And as an anesthesiologist, your job is to keep people safe in the peripartum period. You are the person watching out for, along with the OB team, things like preeclampsia, making sure people are laboring appropriately. You're the person in the room with somebody having a C-section for an emergency or not. You're dosing drugs based on comorbidities like hypertension and asthma, which are incredibly prevalent in minority communities. So I think we have a huge opportunity to make an impact in that moment, and also to advocate on a broader level for things like maternal health care. We see those patients, we serve those patients. It is our business to care. I think the same is true of trauma. I did med school in Philly, where we have a level 1 trauma center and have a lot of penetrating trauma from gunshots, knife wounds, etc. And so, I saw it as part of our duty to advocate for things like reduction of violence, violence reduction programs and schools. It's not just about when the person gets shot, but like what happens afterwards if they're 17. It feels personal for me because I know people who've been shot, and it certainly is personal, I think, for a lot of people I talk to. It's not just about when you leave the hospital. So I think we have an opportunity to take care of patients in the moment, as well as advocate for them afterwards. And then in the ICU, you're having conversations about things like end-of-life care, treatment plans, advocating for the next scan or the next intervention. Historically, I think it's been the case many years ago, and even now with sort of latent bias, that people don't always get the same standard of care if they're people of color. And so as a physician of color, I remember explicitly saying like, hey, I really want to make sure this person isn't being undertreated for their pain. That's something that has been a traditional concern. And I just want to bring it up in rounds and make sure we explicitly stop and address this question. Or at end of life conversations, I think just walking in as a physician of color with a family of color, there's sort of, I felt like the exhale in the room, like, okay, there's somebody on our side who can like at least listen to what we're trying to say. I think that's incredibly important in a situation where people are already feeling scared and nervous and unsure of what's happening and out of control. So I think there's incredible opportunity to be an advocate. And with global health, again, I think being able to provide care, surgical care in very low resource settings is amazing. And anesthesiologists are the ones who allow that to happen in conjunction with the surgical team. So I think there's incredible opportunity to reach out and decide where you would like to see your impact across a huge amount of platform, inside the hospital, out of the hospital, with pain, globally. We have a lot of potential to make an impact.
Beautifully put, Dr. Wright. Very, very inspiring. And it just, what happens, I think, a lot on the path towards, through medical education is sometimes our perspective changes, but it's so refreshing. Part of the inspiration for having you guys as residents talk about your experience is that you're seeing sort of the field, you're going through it, you're being trained, you're living it, right? And so you're the voice of tomorrow. I mean, you're the voice of today, but you're literally shaping the field. And I think it's just very inspiring, and just a lot of what you said resonated, and I hope resonates with our audience here. We're getting a lot of questions. We are going to save the questions for a formal Q&A at the end of the session. So if Dr. Wright, if you can hang out with us until we'll be moderating that. A lot of very good questions. But right now, we're going to introduce Dr. Michael Chavarria. And so I'm going to hand the mic over to Rafa Marquez, who is going to introduce Dr. Chavarria.
All right. Thank you, Dr. Wright, for your time. I know when we were first gathering, the speakers for all these events, you and Dr. Chavarria were like the first people out of Cesar's mouth. He was just he's just like, oh, I want these two. I hope these two could get it first. So it's really nice to hear from you, and I'm really pleasure to hear. So, and all right, so moving on, I'm very excited to welcome Dr. Michael Chavarria. So Dr. Chavarria's parents are from St. Block in Guatemala City, and he was born in Los Angeles. Chavarria grew up in Victorville, a city located in the high desert of Southern California. He majored in history at BYU, graduated from medical school at Western Michigan University, and completed his intern year in Grand Rapids. Right now, he's a CA2 at Stanford and currently applying for an LB fellowship. So Dr. Michael Chavarria, go ahead.
Hey, what's up, everybody? I just want to start off by telling you guys that I put on a new suit for this, so estoy estrenando, which is like something my mom always had me do as a kid. So, but I'm wearing a tank top, so I'm still like really California about it. I just want you guys to know that. So why I chose anesthesiology, right? I'm going to start off at the top by just saying I love drugs, so that's part of it. And I'm only saying that because otherwise I'd have to say that like I love watching people sleep, which is kind of weirder. So we'll start with that, right? So I'm from the Mojave Desert and Sierra Mountains, a third of the way from LA to Vegas. Dr. Zinkowski probably knows that all you really stop for in Victorville, if you're not from there, is gas or In-N-Out, right? Other people from California are like, when they go through the desert. I love it. I like dirt. I get tired of seeing green trees everywhere else. Growing up there, it's not the greatest part of California in terms of like development and opportunities and stuff. It's actually the most conservative part of California, and not like Orange County conservative, like Republican who gets primaried by a crazier Republican. Sorry for politics, but type of area. Anyhow, mostly Latino though, which is really interesting. So when I grew up going to school, I went to school with mostly Latino people who would actually tell me I didn't look very Latino. And I didn't really talk very Latino. But my parents didn't speak any English when they moved here. And so when I first got sent to school, they signed me up for ESL classes, but it kind of turned out that I picked up English on TV. So, you can learn stuff from TV. So went to school there, went to high school. My parents did move back to Guatemala, probably the only Guatemalans moving in that direction, but we did. And I went to school there for a year, and I learned to roll my R's. Kids were mean in Guatemala, just like they're mean here sometimes. And so that's true everywhere. But I learned to roll my R's when I was in Guatemala and learned to appreciate a lot of things that we have here in terms of opportunity. And part of the decision my parents made to move back here was actually so that my brother and I could go to school and have more of the kinds of opportunities that we all have here. I always knew I wanted to be a doctor. There was something about the white coats, and I picked the one specialty that we almost never wear a white coat. So it was butchering or medicine, I think, for me. And I definitely liked the idea of medicine a whole lot more. My parents always kind of supported that idea and encouraged me to do it, but they weren't really able to tell me exactly what I needed to do, which was always tough for me, because I just was kind of like, banging my head against the wall, trying to figure out what to do, what to apply to. And so I got to see my parents work super hard. My dad's a construction worker, and so he'd go to work really early, and I never heard him complain about his job. My mom did all sorts of things. She was a beautician. She cleaned houses. She cleaned hotels. She managed offices. She's kind of an incredible woman. And I learned to work really hard from my parents. When it came time to apply to college, I applied to BYU. Because I'm LDS, and I got in and went there, had no idea. I signed up, the first class I signed up for was a chemistry class, like at 7 a.m, which was like awful. Nobody told me I shouldn't do that. I didn't know. I was like, I'll get it out of the way. It was tough. I started college in 2007 and I ended up finishing in 2015. So it's like, I took time to serve a mission. I lived in New York City for a while and did that, but I also worked. I mean, growing up, I mowed lawns. I worked at a Pollo Loco for a long time. I worked in warehouses. I worked construction. I did all sorts of things to kind of get through school. And again, it was kind of all these skills that I was learning in terms of like just dealing with people, which is a lot of what anesthesia is. And we'll kind of get to that. But once I was in college, I was a biology major. I was pre-med. I'm going to do all the things, but I didn't like science that much. I don't like biology. I didn't know what to do. I wanted to get good grades. And this is going to sound silly, but I found out that Conan O'Brien majored in history and he's a comedian. I was like, well, I bet I can major in history and then do medicine. And I did. So I majored in history. I ended up studying like a lot of like contemporary civil rights history, you know, like Chicano issues and things like that, which I loved. And I got great grades as a result, and it helped me get into med school. I always think that like to get into med school, you kind of need three things. You need good grades, you need to have good extracurriculars, and you need to get a good score on the MCAT. And I took a prep course. I studied so hard for the MCAT. And I remember I was in China actually, and I got my scores like at 3 a.m, and I got my score and it was like slightly below average. And I think I cried for like an hour. I just like wept because I had like put in all my effort, all the energy I had, all the money I had into studying for this thing. And then I did slightly below average. And I was worried, you know, I applied to probably 50, 60 schools, MD, DO, dream schools, but, you know, schools that I was like, well, I don't think I want to go there, but sure, I'll live there if I can go to med school. And ultimately, I went to Western Michigan University. It was a brand new med school. I got into a few different schools, some MD and some DO. And I ended up choosing WMed because it was a brand new school. They had this beautiful building, and there was an Alamo Draft House across the street. And it's a movie theater. And I was like, oh, that's cool. Maybe I'll have some time to watch movies after, you know. And I remember right after I took an exam, right when I was done watching The Force Awakens, I found out that I did okay on my cardiology block exam, because we used to do that. Once I was in med school, I went in thinking that I wanted to do pediatric oncology, probably just because it sounded interesting, right? It sounds like important. And it is. I don't want to shoot down that, but I didn't really know what I wanted to do. And I felt that same pull, like, oh, I should do primary care, right? Because I'm Latino, and that way I can help out other Latino people, and the other doctors don't speak Spanish, and I can do all these things. And so, but we had an anesthesiologist come give us a talk on advocacy. He'd been a Michigan State Senator. He was like really charismatic, gave this whole thing on advocacy. And at the end, he talked about this specialty, anesthesia. And you got to realize that where I'm coming from, when I was a kid, I knew there was doctors, but like, you know, I understood the difference between like a surgeon and this, but like, I didn't understand all the nuances and all the different things. So anesthesia is like, oh, you know, he talked about how in the 1800s, people didn't want to believe in anesthesia because they thought it was immoral, because God wanted you to feel pain. And so there was actually this controversy over anesthesia. And in England, they didn't want to use anesthesia because they thought it was something Americans had made up. And all these kind of really interesting things. And the first anesthesia, well, I guess the prototypical anesthesiologist, you know, went to Mass Gen to deliver anesthesia the first time and was super late. And so it was the first anesthesia delay for the first anesthesia surgery case, which is incredible. And kind of this cool thing. And he talked about how a lot of anesthesia is still a little magical in the sense that we don't know exactly how some of it works. We know that it works, and we have these theories, and we are elaborating on them, but it's still kind of a very just interesting, beautiful area of medicine. And I remember rotating as a student through the hospital, and I would see this anesthesiologist on the L&D floor, and he'd say, oh, come help me place this epidural. So I placed an epidural. Oh, you know, come help me in the OR, come see what I do. And I remember one time I was in the ED, and they brought in a burn patient, and this patient was in terrible pain, just screaming. They couldn't hold him down. They couldn't really do anything to help this person. And it's like a really shocking thing to see as a student. There absolutely wasn't anything I could do. And then somebody came in, and, you know, they asked what was going on and allergies and all this, started asking these questions, people are answering them. And then they somehow placed an IV, and then they gave some medicine, and the patient was just calm. You know, I was an anesthesiologist, right? Like, we, in our specialty, are rarely the ones to definitively fix something, but we set the stage for all that to happen, right? We are literally cradle to grave doctors. We'll be there to help you into this world and to help the people bringing you into this world. And we'll be there at the very end as well, in the ICU or in the operating room, which is tough. And it's like a lot of responsibility, but that's part of the job, and it's part of what makes it so great. And so I remember thinking, as I was getting closer to third year of medicine, oh, you know, what can I do? And I didn't really like the things that you hear about. I didn't like writing notes. I didn't like rounding for 6 hours. I like doing stuff, right? I liked medical equipment. I liked putting things together and taking them apart. I loved learning about drugs and like, how does this work? What does this do to the body? How much long? Like, and I was kind of restless, and I'm still kind of restless, which is why I speak like I have, like, it's why I speak this way, why I move the way that I do. I always want to be doing something. And I like that aspect of things. When I was construction worker, I remember like, oh, go dig a hole. And I liked that I'd get a shovel and then I'd dig that hole. And then there was a hole that I dug, right? And then we could do something with the hole. Medicine, oftentimes when we were in the, trying to come up with these diagnoses and sitting there and discussing them, was just not as stimulating for me as anesthesia was. And so I applied to, again, 50, 60 different anesthesia programs. I applied to Cedars, didn't hear from Cedars. But that's how it goes. You apply to everything, and it doesn't necessarily reflect on you as a person, right? I was able to get an interview at Stanford. I was able to get an interview at UCLA. I spoke to the program director of much smaller community programs that are like half an hour from my house. And I was like, hey, like, post a program to my house. I'd love to interview. And they took a picture of my badge at these like conferences that we have. And then I never heard back, probably because they had so many applicants. And so you do your best, you apply, you do everything you can. And that would be my encouragement to you guys at any level that you're at. Kind of always leave it all on the table. So you don't have any regrets, right? Like, it almost, where you do your residency, you'll learn to be a doctor and you'll learn similar skills. You may have access to different resources, but ultimately you want to match with the place that's right for you. And for me, that was Stanford. I ended up doing anesthesia here with Carolyn, and it's such an interesting specialty. I'll tell you guys about the day in the life thing here in a second, but you're kind of like a Swiss Army doctor, right? Like, again, you're the one who's there kind of making everything work. And like, people also at the same time don't really understand what you do or how you do it. And so, because like most of the time, let's see here, if I can do this. Most of the time, all they see is this, right? It's just like, hey, and I'm wearing a little hat. And if it's me, to be honest, it's probably more up here. So that's kind of what they see, right? Like they know that like they can do their surgery if I'm on the other side and I'm, there. All they worry about is what they're cutting. And then we worry about the rest of it, right? But as far as they're concerned, we're like the Wizard of Oz. We're just behind that curtain, turning dials, pulling levers, keeping patients safe and alive. And to be honest, I have this thought oftentimes when I'm giving medications, it still feels like magic to me. The medicines I use sound like spells from Harry Potter, like paralysis, oh, I'll give rocuronium, right? I want to raise your blood pressure, oh, neosynephrine. And so it's kind of a beautiful specialty, but I will say that it is not the specialty for egos very much. It's a very humbling specialty in the procedures that you do and in the interactions you have with other physicians. Because even though we're infinitely useful, we still do things like raise and lower your table, we empty Foley's, we do all these tasks that people don't typically associate with being a physician because we're that helpful. And we will do that, right? Like, I have put patients on bedpans, I've done all sorts of things, anything that I can to be helpful as I'm present. And so I like to be the center of attention. I enjoy talking, I enjoy doing all these things, but when I'm doing anesthesia, I'm there to support the patient and to support the team. And we do that in all sorts of ways. There's been times when you get called to an emergency airway in the ICU and you show up and there's a patient who's combative, and then they pulled out their lines. And I remember some of the scariest moments have been like, oh, is there an anesthesiologist in the room? And, I'm usually in the back because nobody can see me and I have to raise my hand. And they're like, oh, put an IV in. And and the patient's wrestling and you're like, oh my God, like, we can't do anything if I don't get this IV and everyone's watching you. And over time, you learn to do these things. And I did put that IV in, and then I intubated the patient, and then I left and forgot to write the note about it. So it's, you learn to do all these things that are super, super terrifying. Putting lines in people's necks is a scary thing. All my instincts tell me not to put a needle in someone's neck. And every little bit, every centimeter that I go in, my body is telling me to not go in any further. And guess what? You get taught and you practice, and then all of a sudden you're putting these lines in ways that you didn't know you were possible. It's a wonderful specialty to give you just confidence in your ability to learn to do things, because surgeons may believe that they cut themselves out of their womb and suture it, but like anesthesia, we learn that we know that we learn like little bit by little bit. And so you struggle with IVs. And what a line is something that you hook up to an IV that goes into a vein that allows you to give medication into the circulation. And so sorry if I said line and somebody wasn't aware what that was. But again, when there's a code on the floor, people show up to that code. Lots of people, teams, pharmacists, things like that. When I'm in the OR, I am the code team, right? Like the medications they need, I draw up. I give those medications. I do the intubation. I put the lines in. Nobody mixes things for me. Nobody deliver the equipment to your room. And in some places they may prep them, but most of the time I'm putting together my own equipment, right? Like it doesn't matter what it is, like I'll do it. And oftentimes when you're training, you get handed different pieces of equipment that you've never seen or never heard of, and you get told to use it and you do your best. I remember again, in the middle of the night, getting called to an awake fiber optic intubation, and I'd never used a fiber optic scope, and somebody hands it to you and somebody's telling you how to use it as you're doing it. And then a patient's intubated. And that is kind of a interesting thing. But again, if I do my job right, most of the time people don't notice that you've done your job at all. And that can be difficult. And there's a lot of like social interactions that you're mediating when you're the anesthesiologist in the room. You're dealing with a surgeon, you're dealing with the nursing staff, and you're also dealing with techs, and you're coordinating all this. And it's like a just kind of interesting little dance. And so you do all these things. And again, it's kind of almost like Zen Buddhism, where it's like non-striving action. A lot of anesthesia is in the preparation. And if you do that correctly, again, sometimes people don't notice. There's different approaches to being an anesthesiologist that you can take. I think two kind of popular ones, or ones that we kind of think about it to contextualize our specialty, is like you can be kind of like a chemist and things in that sense, or you can be kind of a chef. And kind of you put these recipes together, or you follow instructions to a T, and they're both ways to operate. So there's a lot of flexibility in the specialty. And like Carolyn said, you can practice in a bunch of different levels. I think Carolyn and I both share and have had discussions about how we specifically really like taking care of people's pain and alleviating that suffering. And I thought I wanted to do chronic pain, and Carolyn and I would talk about the clinic we were going to open up, and it was great. And then I did OB. And I remember, there are very few things in my life that have been as gratifying as a woman who is suffering, like, I don't know, the most visceral pain that I can imagine. And then suddenly you help them with a procedure, and in 15, 20 minutes, they're better. You know, they can tolerate that. And they're so grateful. Like, you would not believe that they forget their gynecologist's name who's been taking care of them for like 8 months, and all of a sudden it's doctor, and they won't remember your name either, but like in that moment they're so grateful. And you go home and it's like, man, I kind of just want to stay here and keep doing these epidurals. Like, this feels great. You do that in all the specialties. Regional does similar things. They do all these blocks and procedures where they're injecting local anesthetics into different people's into different nerves and stuff to help with pain. On cardiac anesthesia, they're taking care of some of the sickest patients who need heart transplants, valve changes, lung transplants, just all of these intensely critical procedures, and they're helping patients through that, making sure that they wake up. You have the pain specialties, you have pediatrics where you're taking care of children with all the differences in their physiology and diseases. You have a lot of flexibility for how you want to practice. You get trusted with a lot in anesthesia. Again, for surgeons, and if you're, anybody in surgical residency, you would not typically leave a surgical resident alone during critical portions of any case. There's always an attending right next to them. With our training and the way that we're taught, eventually we are there for some of these critical portions on our own, because our attending is double covering another resident who's in another room, and they may have to go respond to an emergency outside. And you may find yourself in a situation where you have to deal with critical issues, and you are making medical decisions based on your experience and everything you know, and you're growing. And of course, they do this in sort of a graduated process. They're not putting you in transplants right away. You're starting with lap choles, where you think like a MAP or a lower blood pressure is a very serious issue, and it turns out it's not as serious as you think. But little by little, you get turned into this kind of, again, just doctor. You get turned into a doctor, into this anesthesiologist who can respond to all these things like low blood pressure, who can respond to a patient who's bleeding out. If you put the right lines in, it can be incredible how much resuscitation you can give to keep these patients alive that wouldn't be able to make it through some of these surgeries or accidents without our help. And so when it comes time in residency, it's about your second year where you kind of make a decision about what subspecialty you're going to do, or if you're going to practice privately. Again, you kind of rotate through things, but it's a lot like medical school, in where you may not necessarily get to experience everything before you apply. So just like everything else, you make your decisions as best as you can, right? And you always make those decisions, and you have to accept that there's a lot of variability in what that's going to mean and what's going to make you happy. And so that's sort of the process that I took to get to want to do OB fellowship, and I've applied. And actually, I would say that it wasn't until residency that I felt that I really had a mentor, who's actually Cesar, who interestingly enough works at Mi Mentor and is Mi Mentor. And I think since Dr. Zakowski is actually his mentor, he's kind of like my grandfather. And so maybe one day Pop will give me a job in LA or something, doing OB anesthesia. So you guys always network and always be hustling. So anesthesia is a wonderful specialty, you guys. It is one of the most dynamic specialties. You get to go everywhere. You get to do everything. You're a little bit like Spider-Man, and not like the new one, like the Tobey Maguire Spider-Man, where he tries to help out, but people still hate him for some reason, or aren't always happy. So that happens to us. Again, they blame us for cases starting late, for all these different things. And you know what? A lot of times we take it and we take care of our patients, and sometimes we take care of the surgeons too, and the nurses, and when we can, each other. Somebody just asked if I have ever experienced imposter syndrome. I kind of have this aggressive attitude to not have imposter syndrome. I have the opposite, where when I'm somewhere, I'm like, well, you know what? Even if I'm not that bright or not that good, I'm literally in the same place you are. So haha, here I am, I'm gonna do my best. And so I tend not to worry about that. And a lot of that, my experiences and my privilege and the things that I've gone through, I just try not to feel less than. And sometimes I'm caught really off guard by the things that I don't know. I didn't know there was so many steps. Every time I took one, I was like, oh, thank God, I don't have to take any more tests. And then I should have known that if there's a step 1, why would you call it that unless there's a step 2, right? And then there was 2 step 2s and a step 3, and I'm taking basic and advanced. The exams never end. And they always give me anxiety. And no matter how much I study, I always do just about average. And I don't feel like I'm average at anything else, but it's useful for me to remember that you can't be good at everything, and I'm not that great at tests. So I have to study hard. Again, do your best, and then you got to make it happen. If I could give you guys advice for how to be successful in medicine or life in general, it would be to figure out who you are, what your talents are, and make the most of it, right? I was never, you guys can't tell, but I'm 5'4", so I was never going to be in the NBA, right? I have a hard time when they ask me to hand them the lights in the OR. I've had to jump to hit them the light, and that's again a very humbling experience. But you figure out what you can do, right? I can talk a little bit. I'm kind of friendly, and I'm helpful, and I'm kind, and so I make those things work for me, right? When I work with a patient, when I work with an attending, when I work with a surgeon, I'm doing my job, I'm taking care. I'm also being aware of how people perceive me, and I want people to like me. And that may be slightly narcissistic, but it also makes my job easier, if we all like each other. I want medicine to be a team thing, and I want us to feel good about what we're doing together. And so I try to make the OR or wherever I'm at that kind of thing by being helpful. And my favorite anesthesiologists are the ones that do that. In addition to keeping everyone calm and taking care of everything. Residency in general, for those of you wondering, it is tough. And I don't know if the pandemic made it any easier. I know doctors a long time ago had it much harder and worked even longer hours than we work now. And it's hard to imagine how they were able to do that. Because during the pandemic, things have been tough. I'm not the only resident, but like multiple residents in our class have gone through divorces, relationships that have ended, relationships have started, and it's tough. Like I don't know that anyone chose medicine because it was easy, but it's difficult to appreciate the ways that it's going to be hard for you. And so my advice to you guys would be to know that every specialty is going to be difficult, but you find the one that rewards you enough to be able to go through those difficult moments. So normally what I do about this time in the evening, I look at my cases for tomorrow, and I will call the attending that I'm working with and discuss the case. Is it a cardiac case? What medications do I need? What are we going to do for the intubation? What's the plan? I go through all my patients, discuss them. The next morning I show up early. It's my favorite part of the day. I set up my drugs. I get my laryngoscope ready. I think about my cases. I go speak with a patient, see what's going on with them, see what they're allergic to, readjust anything that I have, and kind of go from there. Then I bring the patient in the room. I hook them up to monitors. I use about the same jokes every time, that they're like a car at a pit stop, and I'm going to hook them up to monitors and not to mind anything. I'm going to top off their fluids, etc. They laugh. I give them drugs. They go to sleep. They start the surgery. Then I keep them asleep. I take care of their vitals. Well, I'm taking care of the patient as reflected by their vitals, right? And so I try to determine if the patient's in pain, if the patient needs fluids, and I make all these decisions based on all these things that I'm seeing in front of me and what I'm seeing on the other side of the drape. Then I wake the patient up. And sometimes this goes very smoothly and your attending's very proud of you. And sometimes the patient wakes up and everyone is unhappy with you, and it takes a while. And you learn to tolerate that. You learn to get better at things. And another part of anesthesia is learning to be uncomfortable with tools and the way that people are waiting for you to do things. But again, you learn to do all those things. Then, depending on what kind of case I'm doing and how long it is, I go see my next patient to start the next case. And I do that throughout the day multiple times. And it's sort of simple, and there's so many things to that, again, that you will never learn in a book, like how to operate all this equipment and how to put things together and how to take things apart and where you can modify things. And you'll learn all that sort of technical things on the job. But ultimately, anesthesia is a specialty where you are a walking ICU, and whatever your patient needs, you will give them, and you will take care of them until someone else can take over their care and they can move on to the next thing. And you also move on to the next thing. And so again, I am super happy to be doing anesthesia. And I think all the things in my life and all my experiences have kind of led me to here and led me to doing this specialty, including obstetrics as a subspecialty. And my parents, like, life is great despite it being in the middle of a pandemic. And I do love what I do, and I'm super happy. It's a very rewarding specialty. I'm very much in love with my girlfriend right now. And the first time I went out with her, the first compliment I gave her was how big her veins were in her hand. And I was like, you know, if you ever have a medical emergency, you're going to do just fine. And she said that was a really weird thing to say. And I agreed. So again, anesthesia can enrich your lives in so many ways. And my girlfriend, Nancy, is one wonderful example of that. But I'm going to kind of leave it at that. Anesthesia is, I think, objectively the best specialty. And so just take that as you will. If you guys do other specialties, I will be personally disappointed in you, but that's okay. So please do anesthesia. We really need you guys. I cannot describe to you how meaningful it was for me to meet Dr. Padilla when I rotated through OB, and I was like, oh, that guy looks really Latino. And he kind of had the same glasses. And then I was like, oh, he's like having a good time talking to everybody. And then I was like, over time I was like, hey man, like, I'm kind of looking for a mentor, and you kind of like, I don't know, it's kind of weird because it's kind of like, I kind of like you and I wish you'd be my mentor. And then he's like, oh man, like, I remember thinking like, you kind of look Latino too, and you were wearing these gold chains and like you had a fade. I thought you were Latino, but I want to ask, and I saw your last name. And then it's like, oh, did we just become mentor and mentee? Yes. And it was great. And he's been super helpful. That's why I'm here giving you this talk. So be open to those things. Know that sometimes they are rare, unfortunately, and it's hard. So if you find something, like, hold on to it, do your best, and you'll find those people who will guide you through this process. Again, it took me, I'm 33, it took me a while to find it, right? And I did when I was 32. So it may take a while, but when you do find it, make it happen, and keep that in mind as you're coming up too, because you do your best with everybody else, right? Like, hopefully, again, Dr. Zakowski mentored Padilla, who mentored me. I'm here. Maybe I'm going to mentor one of you guys, right? And like, then you guys are going to mentor the next one. And that's what this whole thing is about. And that's how these things change. We're not going to go from 5% or 20% to 50%. And I don't know if that should be the case, but like, that's not going to happen overnight. But little by little, we can make an impact in this area, which will lead to better outcomes for our patients. And all the advocacy that you can do in primary care, I've now finding the opportunity to do in OB anesthesia. And you can do that in pain. You can do it in general anesthesia. If you are passionate about advocacy, you will find a way to do it, and it will find you as well. So don't worry about that. If that is something that you're passionate about, pick the specialty that you feel you're most suited to, and that is most suited to you, and then make the most of it. And I think anesthesia would be a great choice for you guys to do that.
Wonderful, Dr. Chavarria, wonderful. And I want all our speakers, so we're going to jump into a Q&A session. And I forgot to mention in the introduction that there is going to be a post-event survey. Please fill out that post-event survey. There's going to be, you'll have access to our speakers' emails for more questions once you fill that out, to more Me Mentor events. But one of the things that really just, I believe, is so important to sort of pass along and to emphasize to our viewers is the personality, right? The personalities of Dr. Wright, Dr. Chavarria, how much a doctor can make a difference. And so think about it from a patient's perspective, whether you're in the labor, whether it's a pregnant woman who is going to have a baby, or someone who's going to have an emergency surgery, or someone going to have a different type of procedure. We have just a few minutes where we meet a patient, and it's our responsibility to make them feel comforted and to have them trust us. And that's something that it's incredibly rewarding, very difficult to put into words. But one thing that I sort of heard, right, themes of with Dr. Wright, Dr. Chavarria, is this theme of advocacy, the fulfillment, the personal fulfillment of coming home every night and, wow, you just did something incredible, like put a breathing tube down someone's airway. I mean, these are skills, guys. Like, it's one of those fields where you're sort of indispensable. You have this set of skills that are critical. And when Dr. Chavarria said you're a walking ICU, that's quite literally true. I've also heard that as well, that an operating room is an extension of a critical care unit. You have this sort of innate set of skills that bring value, but value in different ways. It's not just a set of skills, but value in saving someone's life and becoming an advocate. And that's really something that's important, because that theme of advocacy is something that really is I believe is central to our field in anesthesia. Okay, so we are going to jump now to our Q&A session. So Joanna Gonzalez and Vanessa Alvarado are going to be asking Dr. Chavarria and Dr. Wright a few questions, and whether it's you, Michael, or Carolyn, whoever wants to answer the question, or both of you, if you guys want to answer the question, it's all good. But we're doing good on time, and yeah, I'll sort of transition on over.
Thank you, Dr. Padilla. Hi, everyone. I'm Vanessa. Okay, so I'm going to go based on the questions that were submitted in the chat box first, and then once we get through those, if we have time, we'll just open up the floor and you can unmute yourself. But the first question was asked during Dr. Wright's time, and it was, would you please talk more about your experience as a non-traditional student?
Yeah, sure. So ultimately, I had 6 years between the end of college and the start of medical school. I also took a year off of college. I worked, saved money as a waitress at 2 different restaurants. I was a terrible barista. I don't recommend coming to me for coffee. But I think that was an experience Michael had as well, and maybe one that you share. I really took a lot of time to figure out what I wanted to do. I think depending on your background, there is this sense, and I certainly heard it from some of my friends' parents, like to be successful, there are 3 things you could do. You could be a doctor, a lawyer, or an engineer, maybe go to business school. So on the one hand, I had that in my ear, and I actually really don't like that idea of success. I think it can be sort of this treadmill where you put others' expectations of you ahead of your own ability or joy in doing things. And I had other experiences of that in my life a little bit. The other part of my experience, I guess, is like my parents both grew up on farms. Not much money. My mom was like the youngest of 8. My dad was the second of 6. My mom never graduated from college because she didn't have the money to do so. My dad did graduate from college, but I was sort of trying to find my way into medicine without like a ton of familial experience doing that. So I worked for a while. I wanted to know I could support myself. I volunteered as a way to try to figure out what I wanted to do. So I volunteered with that syringe exchange program. I facilitated a group on women's health and sexuality in DC, which I thought was really helpful. And then I think just having that time to step away from school and step away from like expectations of what I would be doing actually really helped when I went back into school. I think in a lot of ways, if you haven't already found it, medical culture can be very, very conservative. I think there's a lot of history about like who goes into medicine, sort of what privilege you might need to go into medicine, that can be challenging. And I think just having other experiences to fall back on was helpful when I was like, oh, I don't particularly look like everyone in my class. I'm older. I have different concerns about like, maybe I want to start a family, or maybe I'm trying to like save up for this thing. And it was just helpful to know like, okay, I have like these other skills I've done. I've like taught, I've done outreach. I've worked in a company before. I'm approaching this like a job. And ultimately, I think that was really helpful. On the way to, as a non-traditional student, I heard a lot of people say like, I'm not sure I understand why you want to do this. You didn't come straight through from college. My grades in college were not stellar. I did a post-bac program to do all of my science credits. And so I really had a lot of self-doubt as a non-traditional student. And honestly, it's something I've heard from a lot of underrepresented minorities who have applied regardless of path. And so it's really important to talk to other people who have been there before you so they can tell you like, hey, I think like you actually do have a shot at success, or like, hey, maybe you want to strengthen this part of your applications. I've known people who were accepted to top medical schools, top residencies, who were told by their advisors without that experience, like, you're never going to get in. Obviously, that was not the case. And I would like you to have a realistic expectation of what might be coming. So just talk to somebody who is coming from a similar path. I hope that answers the question.
Dr. Yeah. Oh, thank you so much, Dr. Wright. We really do appreciate that response. And just to move forward with the questions, since we got submitted a lot, the second question is around, can you talk about your experience applying to anesthesiology residency, how competitive it was for you? And we can probably start with Dr. Chavarria and then with Dr. Wright.
Okay, so practically speaking, I looked at all the anesthesia programs in the country on this like list that you look at. I looked at the average scores for everyone. Then you do your best that you can on those tests to get the scores. But like ultimately, my score was like slightly below average for anesthesia residency in general, and including and more so for Stanford. And I even again, I'm non-traditional, but I'm kind of like just a bulldog about these kind of things. And I'm just like, well, I'm gonna just give it everything I got, and then I'll be happy wherever I end up. And I believe that I would have been. There's all kinds of programs that you can sign up for as a medical student to rotate away at places, and they have scholarships. I know that that's been different during the last couple of years. But what it really amounts to is that you are trying to find ways as a as a medical student to make connections with residencies. An away rotation is an excellent way to do that. However, you have other opportunities. And so for some places it was emailing, for other places it can be going. And I recognize a pandemic has changed a lot of this, which just means that you need to be more creative about doing these things. And so I looked at all the residencies. I applied to like the 50 that I would be willing to go to. And then once I started getting interviews, I started cutting it down to the area where I wanted to live, which was in California. So the places that I wanted to get interviews more than anywhere else were in San Diego, LA, Loma Linda, and the Bay Area. But LA more than anywhere. I thought Irvine was like my top choice, just because it's like a perfect situation. And then you start learning about like you start learning about like the reputations of different programs. And then because I went to a newer medical school, I had to make a lot of the things that I wanted. I had to start a chapter of the LMSA. I had to start our student run clinic. And I knew that I wanted to go to a residency where there was more established things that I could then learn. So instead of practicing the skill of making things happen, I could learn the skills of like, how do you operate in a place where all these things are already set up? It's a very different skill set. And so I was more interested in these bigger programs, but I interviewed everywhere. And it's hard to say, I feel like I ended up in the right place, but it's possible that I could have been happier at a community program. We'll never know. So you try to be happy with the decision. And I've met tons of people from other programs that are as happy as I am, right? It ultimately, what makes the experience is going to be you, but you apply and then you make your application for what you're looking for. Or it's not much different than like a Tinder profile and what you're doing with that. You are literally trying to match, right, with the residency. And so like the kind of application that I would have to apply to New York City would be different than LA, right? The Bay Area has a slightly different flavor than Southern California. I like Southern California more. Don't tell anyone at Stanford. But like everyone out here is like really intense about everything all the time. So you go out, once you get your interviews, you may only have time to go to anywhere between 8 to 15 of them. Like you can't go to an unlimited amount of interviews during normal times. Now, things are very different for you guys. You guys can go to more interviews, but they're on Zoom or they're virtual. And so you have to learn to apply a different skill set. How do you come across successfully in a virtual meeting? How do you learn to communicate those things that you want somebody else to know with the awkwardness of all this, right? And so one, you want to be the best kind of candidate that you can be. And that's everything that you've done in your life up to this point. And then you got to learn how to communicate that through your application and through your interview. There should be a theme through the whole thing. For me, it was that I'm friendly, helpful, and I care about people. My personal statement had that. My CV reflected that. When I talked to you in an interview, the only thing I regret including in any of my interview stuff was that I wrote down that one of my hobbies was that in college I did stand-up comedy. So everywhere I went, somebody asked me to tell them a joke, which was like the worst thing, because if I was any good at the comedy, I would not be a doctor, right? So like my jokes weren't great, but I told my jokes. One time somebody caught me off guard because they asked me what tree I would be or something, or what color I would be in an interview. And it took me like a few seconds, I don't know. But after that interview, I could have told you what tree I'd be, what flower I'd be, what color, what animal, what actor. Like I could have told you what version of anything I would be and how it would reflect somebody who'd be a great anesthesiologist, right? And so it's all prep, which is good practice for anesthesia. You prep as much as you can, and then you adapt to whatever comes your way, because what comes your way is really rarely whatever you prepare for. And so you do that kind of with your application. So that would be sort of the steps you'll learn, and you can Google and someone can teach you that. But just put your head down and do your best. It's like really simple advice, but you really, really have to do your best, more so for yourself later, so that you have that and you know, like, hey, this is the best place I can be and this is the best I did. And that's great wherever you end up.
All right. Thank you both for answering that question. So this one's a little more particular and more specific, and I want to go ahead and address this one to Dr. Zakowski. And so the question asks, there's a lot of talk about cRNA positions replacing anesthesiologists. So should future anesthesiologists be concerned about this? Just kind of, what are your thoughts about that? Just a little bit of discourse about that.
Not worried. I mean, just as the demand for anesthesia services has increased, it seems to keep increasing as well. Anesthesiology is really about being that perioperative physician and caring about the total spectrum of care and what can you do to optimize the patient medically pre-op, not just, as they say, turning the dial up and down, intra-op, and planning everything to include the post-op course. So you're part of an anesthesia care team, whether you could be doing one-to-one care in the operating room, and maybe that is less so in the future for simple cases with healthy patients where it doesn't need all your experience and expertise. Or in many places that's you're doing one-to-one on the more complex cases, or I'm supervising 2 rooms with 2 residents or a couple rooms with CRNAs in them. I don't see that really changing. I do encourage everybody to do a fellowship, find something you're interested in. That way, I call it the one more year after 12 years of higher education, to go ahead, do a fellowship, and that'll guarantee that you're in charge of some service. Yeah, I don't see it as a problem. If I do think our speakers, Carolyn and Michael, were great. If you want a position, Michael, I'll hook you up. But yeah, I mean, anesthesiology is great, as you've heard about a broad spectrum of things you can do from within anesthesiology. And what's nice is that even after 30-something years, I go home feeling good. You make a difference every day, and certainly every week. Even, and I'm thankful, I don't remember which person I interviewed a month or 2 ago who reminded me that even if you're doing one-to-one care, that to that patient and their family, that's everything. And that this medical student was interested in going into anesthesiology because she had had a family member who needed surgery and was taken very good care of by their anesthesiologist. And like I said, even like I never would have thought I have done all the stuff that I've done. That you just participate, and you can have an effect one-on-one. You could practice one on many, or even one on the national level. For instance, you can help reduce, if I can, right? As SIL president, one of the things I did was to come up with enhanced recovery, have the society do after cesarean, which is both to help improve patient outcomes, but it also reduces healthcare disparities as well. I'm very happy to say ASA, our committee of obstetric anesthesia put out a statement that was approved at House of Delegates, reducing maternal peripartum racial and ethnic disparities. So there's a lot you can do, and it's not, if you want the bigger scene, you can accomplish that too. So one-on-one, one-to-many, or even one-to-national. All that can be yours. Thank you.
Thank you, Dr. Zakowski. So we can move on to a couple more questions. Well, actually, this one isn't a question, but it was said that what you are all talking about reminded me of this quote: "Don't ask what the world needs, ask what makes you come alive, and go do it." Because what the world needs is people who have come alive. And this was said in respect to Dr. Wright being an amazing example of this, and Dr. Chavarria. So thank you both for sharing your experience. We did want to pose a question that was asked a couple times privately a little bit. And so it says, this person said, "Dr. Wright, I really resonate a lot with your story. I feel such a push to go into primary care. I recently found out the many different subspecialties in anesthesiology. As someone who recently went through many surgeries and experienced pain for months and having to rely on opioid medication, this really pushed me to explore the field of pain management. Do you have any tips for anyone really trying to match into anesthesiology, and especially as a DO medical student?"
Thanks so much. I'm sure the anesthesiologist here can help respond to that. I think anesthesia is a great field. I think it has a lot of diversity in terms of MDs and DOs who match, as well as in terms of background. So one of the reasons I love Stanford's programs and many of the programs I was at was the diversity of applicants. So I would say there's no hard cutoff score for step one, for instance. There are people sort of across the spectrum who have matched. It is getting a little bit more competitive from what I understand, but my experience, at least, and this is just my experience, is that applications were sort of more holistically reviewed. So research was not as emphasized as other like surgical subspecialties where you really do need published research to match, or like a PhD. I did one paper in med school, and I think even my co-applicants had no research experience coming in, and still matched. Step scores I've addressed. I think it's important to show an interest in anesthesia. A lot of committees understand that med students come to anesthesia a little bit later. So as I said, I came to anesthesia my 3rd year and 10th month before applying my 4th year. So it was definitely late in the game, but they looked at my other activities in med school, and I could sort of make a cohesive story about why my path made sense to anesthesia. If you know now that you might be interested, I think showing interest is a really powerful way to convey that you're sort of dedicated and really excited to be in anesthesia. I'd say letters of recommendation are really important, and then your clerkship grades. Yeah, I wish I could give you sort of the formula for success, and I think that was definitely what I was looking for when I was applying. I don't know that there is a formula. I can tell you that at programs like Stanford, where diversity is really emphasized, there's a lot of dedication to a holistic review of what your pathway has been, where you've come from, how you've grown across that. So even if you didn't have the highest grades in college, like what's happened since. So I'd encourage you to apply, even if you're not sure.
I'm just going to say, for anything that you guys are applying to, I think a big part of succeeding is going to be preparation. And what I mean by that is research into what the program is, who the people are at the program. If you don't know something, Google it. And again, a lot of us who are here didn't know a lot of things going into medicine. The program director for where I'm at has self-published a memoir about travels in Spain on Amazon. Guess who read that travelogue about his sabbatical in Spain and talked to him about it when I rotated here as a student? Me. Was it awkward? Of course. Is that the reason I'm here? I don't know, maybe. But I did the research, right? Like, if you want to get into a research lab and you're interested in anesthesia, see if anywhere around you has an academic program that's doing research in anesthesia, and then email those people. It's extremely flattering to have somebody be interested in what you do. And so just start off there. But again, it's going to be your preparation, because you can ask us all these questions, but nothing is going to be as valuable as you finding the answers that you need and then clarifying. we're almost more helpful at clarifying things than we are at answering these broad questions. Like, how do you get into med school? How do you get into this residency? It's really hard because each one of us is different and we don't really know what parts of the things that we did were the important ones and which ones weren't. But I can help you, guide you if you do the research ahead of time. And that goes the case for all mentors. What you want to see, I think, is some effort, because then you know that it's worth doing because a person is going to follow through. So put that attitude into everything you're applying to and everything you're doing. Just know everything about it as much as you can, you know, just like those Wikipedia deep dives in the middle of the night, we're preparing you for this. This is what that was for. Every time you scroll through Reddit, it was in preparation for you to get the residency that you want. Go and do the research on the people there, residents there, email them, whatever you need. Follow them on Twitter, follow the programs on Instagram, like their posts, comment on their posts. Guess what? Someone's going to remember your name and you don't know what's going to matter. You're like a fisherman casting lines. The more lines you cast, the more nets you cast, the more you're going to catch. And sometimes there's only one fish out there. So like, throw out as many nets as you can would be my advice for that.
Really, really good answers, Michael and Carolyn. And, you know, I think what's also important is to be your authentic self, to really pursue what is meaningful for you. And, you know, we heard this from both Michael and Carolyn, and I certainly experienced this myself, where I almost felt a little like I was pigeonholed or trying to be pigeonholed into primary care. And it took a little bit of bravery. It took to say, no, I want to do anesthesiology because it speaks to me, because I want to work with my hands. And so I think that theme sort of came across today is being brave in what your purpose is. And I really love how, you know, Dr. Wright is sort of channeling her purpose into the field of chronic pain, and Dr. Chavarria, is, you know, we've worked together on obstetric, you know, labor and delivery, but it's really choosing a field where you come alive, if you will. And, you know, I look back and there's no question, you know, it almost feels like anesthesiology is the best kept secret. Like, like this is where it's at, guys, you know? But I really appreciate, first of all, the fantastic questions, but the energy and the purpose behind our speakers. Can you guys talk about, Michael or Carolyn, can you guys talk about the away rotation that we have at Stanford called the SCORE program? And I don't know if either of you are sort of alums of that program, but I think it's very helpful for our audience to hear about that, because the question of away rotations has come up.
So SCORE is like a scholarship visiting rotation program that Stanford has. And Stanford, it's called SCORE, but lots of other programs have them. And so I found out about them when I went to an LMSA conference in Miami, and they just had booths and they're like, apply to our program. And Stanford actually paid me, I think it was like $2,000 to come rotate at their hospital. And they also hooked it up with housing while I was there. And then they had me meet people, and then I met the other students rotating there. And there's a few of us in the program that did this. And it's a great thing, because again, otherwise it would be difficult to make some of these connections and to meet some of these people. You still had to work hard, and you know, you better believe that if they told me to show up at 6, I was there at 5:30, you know, before I could even get anywhere, just like waiting because I didn't know what to do. But that's what those programs are. I was also accepted at Harvard has one, but it was at like the same time. So you apply to a handful just like everything else. You know, you fill out your personal statement, and I'd recommend you guys save every personal statement you write. And then, you know, by the time you're my age, they're all just like kind of copied and pasted and adjusted and stuff, because the things that were true about me when I applied to medical school are still true as in residency. The things that you do to be competitive for SCORE are the same things that you do to be competitive for residency, for medical school. You just, it's hard to say, but it's just being the best version of you that you can be, right? It's going to be different for somebody. There are plenty of people that I work with or that I went to school with who did way more than I did and make what my meager contributions seem small. And there's people who did less than me. And so you are going to exist on the spectrum. And I would say my advice and what I try to do is do as much as I can. And then I try to have peace with that. There's other people that have more energy than me and they're smarter, you know, and all these things, and they can maybe do more, and that's okay. But I just do as much as I can. So it's hard to say, but like, again, the things that I did to be competitive for that were like, I volunteered in medical school. I did the things that I like to do. I, again, started a chapter of the LMSA. We published some things there. We did a Latino student run clinic that I was a part of. And so I just was me, and then tried to make that look good on paper. And so be the best version of you and try to do that. But again, it's almost not like, it's hard in medicine. It's really hard to take. You should not take it personal, even though it will feel that way, because if you're not accepted to something, it's because there's like literally 50 to 100 versions of you that also applied for that same thing. And it's not that you're not good. It's just that, like, you know, could you imagine making a choice between 100 great candidates for 10 spots, for 5 spots, for 1 spot? I don't know. It doesn't matter how great everyone is. There's only 1 spot, right? And so you do your best. So I applied to Stanford's, Oregon's. I went to OHSU, and I had to pay for my own stuff, and I didn't get into their scholarship one, but I still went because I wanted to make those connections on the West Coast, and Stanford and Oregon were the places where I was able to do that. But again, if you want to go to a specific area, it was especially important, and it was part of like a strategy for me because I was in Michigan for med school and I wanted to come back home. And so this was my way of saying, like, look, there's something, I've done something to get back here. So I could say that to programs, right? You know, and so maybe your strategy is different. But again, I still applied to programs at Hopkins, at Harvard, at Michigan, basically anywhere that had one of those programs. And how did I do that? I researched, I went online and just Googled all these things. I didn't even know the language at first, right? They're like, so you start Googling like, oh, rotating visiting student scholarships, URM, Latino, Hispanic, you know, minority, and like all these things. And sometimes they come up. So again, I'm not pushing Google as like a product company or anything like that. I'm just saying, like, look things up as much as you can. Ask online, go and find that information. There's so much information online for all of this. And then, you know, you'll find out about this program, and then you'll find a name and like, oh, you know, Cesar Padilla, I saw him at that thing, and I can ask him. And then you email him and you ask him, hey, what can I do to get to Stanford? And then he'll give you some pointers, and he'll be, you know, if you want to go to Cedars, now you've met somebody at Cedars, right? Like, you've met Carolyn. If you want to ask somebody about residency, it's part of what you guys are doing right now is part of that whole process. And so continue doing these kinds of things, attending a meeting in the afternoon on a, I don't even know what day it is today, on a Thursday, right? It's not the most fun thing to do, but you know, you come, you learn, it helps prepare you. This is what you should be doing. And so keep putting this kind of effort into your other things, and you will be a competitive applicant.
Thank you so much, Dr. Chavarria and Dr. Wright. So we had a lot of great questions submitted, but just to sort of, you know, wrap this up, due to time, our last question will be this. So for both Dr. Chavarria and Dr. Wright, what fun activities do you both do to cope with burnout and stress?
I think this is a really important question, and I saw it sort of related. So burnout and stress, and then somebody else asked, you know, there are good days and bad days. Is there anything difficult about anesthesia? There are definitely difficult days, and residency is hard. Like Michael said, I think it's the difference between knowing like you'll be jet lagged and then experiencing jet lag, two very different processes. Knowing intellectually that residency will be hard is very different from experiencing like a day in, day out. Just it's a lot of work. It's wonderful work, but it can be hard. I think some of the hard things in anesthesia are when a patient doesn't do well. You know, we manage very high risk patients sometimes, and sometimes patients don't make it, or they come out and something has happened like a heart attack or a stroke, and we're encouraged to be responsible for patients. I think the potential dark side or flip side of that is it can be hard to leave behind that sense of responsibility when something doesn't go well. And so part of taking care of myself has been finding people to talk to about it. I think as a literature major, I love doing creative writing. I don't know if anybody could make sense of my stream of consciousness, but it's been really helpful for me. I think finding a purpose to the medicine I'm doing is really important as well, which is why I chose pain. I think, unfortunately, as people get older and sicker, sometimes it's really easy to wonder, where the line is between doing good and just doing something because it's possible. And so I think it's important to keep a bigger picture in mind of why you're doing what you're doing. And then I really love making cookies and I eat them after I make them. I encourage everybody to do that. I bake for other people. I cook for other people. I think feeding people is a way that feeds me in a way. So just finding ways to have connections outside of work, I think is really important.
I agree with Carolyn, and I've been the beneficiary of some of those baked goods, and they are quite good. If you look back here, that is my living room, where oftentimes when I come home stressed or tired, I kind of do this thing where like I dance, clean, and cry at the same time. And so depending on what kind of bad day it was, there's variations, right? So sometimes it's more crying, sometimes it's more cleaning, sometimes it's more dancing. I'm not good at any of them, but I do them with a lot of energy. And so some days it's those things. I really like to snowboard. I don't get to go out and do it, but I'm going to go a few times this season. I'm really excited about that. I love watching TV. I love going to the movies. But ultimately the thing that re-energizes me the most is spending time with people, right? My family, my girlfriend. It's that like, I'm so extroverted that I just get so much energy and so much of my like, just life and energy from like experiencing those relationships. And the pandemic's been very uniquely challenging for a lot of us extroverts. And hopefully it's given us a little bit more empathy for our introverted colleagues who have had to deal with, the opposite for quite some time. But you figure it out. And again, there's no such thing as work-life balance in residency, just because you're not very autonomous. And so there's a lot of frustration that leads to that can lead to, but you find the things that make you feel better. And sometimes it is like staying a little bit longer to just complain with a resident. We're a different generation. There's generations like my parents never complained about anything and did so many hard things, much harder than me. And millennials, and I don't know, I think you guys are millennials too. I'm not sure where the line changes, but like millennials complain about everything and our feelings are so important. And I have so many feelings about everything. And sometimes I need to get that out. And the best person to do that with is with a co-resident who kind of gets it. Because sometimes you start telling somebody else what your day is like and what the feelings you have and the things about what you do. And they don't get it. And it can be kind of scary, but like it can be good to get that out. Again, I'm rather famous for oversharing in our chat group, in our anesthesia residency chat group. And there's different ways to deal with it. So you find the things that you do that energize you and you do your best to do them. And you just accept that residency will at times leave you without times for those things that energize you and will drain you to your limit. And sometimes slightly past your limit. And just like everything else, you adapt, and suddenly you'll find that the things that you couldn't do before, you can. The things that you couldn't tolerate, you will. I didn't know that I could still be awake after working 25 hours, but guess what? I can. And like I start triple checking everything I'm doing, everything that I'm drawing up, every label that I'm, everything that I'm giving the patient, because I know I'm less aware, and that's what you do. And so all the same things that you would do in your regular life to feel good, that's what you do as an anesthesiologist to feel better. Just as a resident, sometimes you will not have as much time as you might have during other times in your life. And that's what we trade to sort of learn the craft, I guess, so to speak.
Thank you so much, both Dr. Chavarria and Dr. Wright. And as Dr. Zakowski says, especially with COVID, there are many institutional resources and programs to help well-being, help at hospital or elsewhere. So thank you all so much. And just to wrap this up, I'll be posting the post-event survey. I know we didn't address a lot of the questions, but by the folks here who are part of the call, by you filling out the post-event survey, you'll gain access to our two speakers' address. And as Dr. Chavarria mentioned, networking, really reaching out and asking those questions to both of them. So let me post it here. Okay. So that's our post-event survey. Please fill it out. It only takes about like a minute or maybe 2 max. And I'll pass it over to Vanessa, who'll talk about next steps and our upcoming events.
Thank you, Joanna. So just as Joanna kind of prefaced right now, we're going to have more upcoming events. As we kind of mentioned a little earlier, this is a workshop series of about 6 events that we're kind of just crafting as we go to really immerse everyone in the fields of anesthesiology. So we hope you enjoyed this first installation. There's more to come. And again, sorry about the Zoom link drama. It was, we're kind of fixing everything as we go. I'm going to go ahead and put up the QR code, excuse me, sorry, for the post-event survey. That way everyone has, okay, cool. That way everyone has access to it. So here's our post-event survey. Jonna also put in the chat box. Go ahead and take a picture of this QR code. This event survey really helps us because we're trying to get as much feedback to then make this series that much more tailored and more specific to the needs of pretty much our constituents, which are pre-medical and medical students as part of Mi Mentor. And if you're not part of Mi Mentor, another shameless plug that we'd love for you to be part of our community. And so you can go ahead and sign up at mimentor.org. And yeah, so I think that's pretty much it. I think we can go ahead and disband if anyone doesn't have any more questions or comments. Thank you all so much for your time. And hope to see you soon. Hope we can get our next events collateral up and running sometime soon, but our next event will be sometime in late February.